demonstrate to you how to give your horse a vaccination. Good afternoon. My name is Sarah Williams. I'm 15. I'm from Anne Arundel County, and I'm the president of Olympic and 4-H High Riders. As I mentioned before, I will be demonstrating to you how to give your horse a shot. There are 3 different kinds of shots you can give your horse, and I'll be demonstrating 2 of them using a banana, a hypodermic needle, and water that has been dyed blue. The 3 different types of injections you can give your horse is a subcutaneous shot. This shot is administered directly under the skin, and you administer this shot by pinching a little of the skin, and you insert the needle right into the base of the skin fold, and once you feel the needle pierce the hide, that's usually enough. And you'll pull back on the syringe to make sure no blood has entered the needle and you haven't hit any veins or blood or arteries, and you'll inject the serum. An intramuscular shot is given usually in the side of the neck or on the rump. It's given directly into the muscle, and again, you'll insert the needle. This time you want to make sure you insert it in the muscle, so you insert it a little deeper. You'll pull back on the syringe to make sure no blood enters it so that you haven't hit any veins or arteries, and you'll inject the serum. When you are giving the injection in the rump, though, this is usually when the horses will kick, and so you have to be a little careful. An intravenous shot is probably one of the hardest types of shots to give your horse. This is usually done by a veterinarian. If it has to be done frequently, a veterinarian may put a catheter in your horse. This is given usually in the jugular vein. The way you do this is you apply 2 points of pressure, and the vein will sort of rise up. You'll insert the needle into the vein, and you'll pull back to make sure blood does enter the syringe, and then you'll administer your vaccine. You may be asking yourself, why would I want to administer my own shots to my horse when I could get a veterinarian, a trained professional, to do it for me? There are 2 main reasons for this. The first reason is in an emergency, if you know how to deliver a shot to your horse, you may be able to deliver a potentially life-saving shot without having to wait for the vet to get there. The other is that it is more economically reasonable. Getting a vet to come to your farm to give your horse a shot is pretty expensive, especially if your horse is in some kind of condition where they need shots more frequently than regular horses. Also, you may be asking yourself, what type of needle should I use? Safety is always your first concern when giving your horse shots. So you want to use one-use disposable needles, because if your needle is dull or dirty, you could end up giving your horse an infection, and that can lead to an abscess, which are not fun to deal with. I've found that using an 18-gauge, 1.5-inch needle is appropriate for the intramuscular shots, and you could use a little bit of a shorter needle for a subcutaneous or intravenous, because you don't have to go that deep into the horse. And you, to choose the size of the syringe, you have to know how much of the serum you're going to deliver to your horse. For something you would only need 1 or 2 cc's of, you could probably use this small syringe, whereas if you need 20 or 30 milliliters or something, you could use a larger syringe. There are many different vaccines that are suggested for your horse depending on what your horse is used for and in what area you live. Many horses, such as race horses or horses that are shown, they're out more and they may need more types of vaccines rather than maybe just a trail horse that you just have around your house, or just maybe a lawn ornament even. The suggested vaccine schedule for horses in our area, like the horses that would be at a show, the annual vaccines you want to get are the tetanus vaccine, the encephalitis vaccine, which is sleeping sickness, and there's an eastern and a western version of this, the rabies vaccine, the West Nile vaccine, and the myeloencephalitis. The semi-annual vaccines you want to get for your horse are the Potomac horse fever, the rhinopneumonitis, which is for the herpes virus, and strangles. And the influenza shot you would want to give a little more often, about every 3 to 4 months. Now for the actual demonstration. When you give your horse a shot, you would want to wipe it with some type of alcohol or an antibacterial wipe, just to clean the injection site. You would then take your needle and you would insert it into your vial, and you would take out just enough serum that you need. And as I said, for a subcutaneous shot, we're going to pretend like this is the directly at the base of the skin fold, just enough so that it pierces the hide, and you would inject your serum. Doesn't work exactly as well on a banana as it would on a horse. And then you would just apply a little pressure and maybe, yeah. For an intramuscular shot, and the subcutaneous shots are usually given on the side of the neck. An intramuscular shot, you would do the same thing. You would wipe it with some type of an antibacterial. You would take out the needed amount of your vaccine or your serum. You would inject it in your horse. For an intramuscular shot, you have to make sure you get it deep enough that it actually enters the muscle. And you pull back to make sure no blood enters the syringe. And then you would administer the shot. I would also like to take a minute to clarify one misconception. Many people that aren't around horses much think that the Coggins is actually a vaccine, when it's actually a blood test. I've heard from many people that Coggins is a shot, but it's actually just a blood test you need to get for your horse. And in conclusion, I have gone over safety for injecting your horse, reasons for delivering your own shots, and methods of injections for your horse. Thanks for your time. My bibliography is www.equinevacservice.com, www.aces.com. My trainer was Terry Norris, and the Animal Science Day Clinic at the Anne Arundel County 4-H. Thank you. Are there any questions?
Do you give vaccines yourself at your farm?
I actually haven't yet, but I'm planning on giving them when I get my horse, possibly.
Are there multiple places you can give an intramuscular vaccine on a horse?
Yeah, usually the two best places are in the neck or in the rump.